So today we're going to be doing a specialist Endolift vector bum lift for this patient. And the first stage, which is very important, is to draw out the vectors. So we're going to start with just the left cheek here. As you can see, we have marked out the vectors as to where we're going to pass the fibre. So we're going to use a 1mm fibre. So this is quite a rare fibre to get your hands on. We're one of the only clinics in the UK to get our hands on this type of fibre. And I think we're the only clinic to offer this procedure. But if you have a look, you see where we've drawn out these vectors is exactly where we're going to pass the fibre. And we specifically used a black marker. And the reason is because the wavelength of energy that comes from this device is attracted to the color black. And so by drawing out black lines, not blue, not red, it will allow a lot of the energy to come up towards the surface, towards the skin, which is where we want a lot of the energy to be placed. And by passing the energy down each one of these vectors using the fibre, it will cause a lot of collagen stimulation along each of these lines over the following weeks to months. And where we've drawn these vectors in this very specific pattern, so that when that happens, the bum should lift like this. And over the following weeks to months, the patient should just see all of these tissues contract in the lines of these vectors, causing a nice lifting effect.
Here we go.
This is, as you can see, 1mm fibre, very special fibre which is used for very specific purposes, and we're going to be using this today for the vector bum lift. Normally, when we use Endolift, we use it in a pulsed setting. So if I step on the pedal here, you can see the laser is pulsing. Whereas for the specialist vector lift, we're going to be using a unique setting. It's called a continuous mode. So as opposed to being pulsed, you can see the laser is just constantly on, which allows us to give us that retraction that we want along those vectors in order to help lift the bum. So as you can see, we've drawn these vectors on top of the skin. What we're going to do is we're going to pass this fibre along each of these vectors. We're going to use about 7-watt continuous energy, and we're going to fire it back in this direction up on each one of these individual vector lines. And when we do that, the skin underneath each of these vectors is going to tighten and contract, and it will continue to do so over the following weeks to months. And as it does that, with each one of these vectors tightening, as you can see in this very specific pattern that we've made, it's going to lift the bum up like this. So we're going to do a first pass here. So pass this fibre. You can see we're going along this vector, just underneath the skin. How does that feel? Okay. And we're going to do 4 passes.